Fellow Dominicans, let me express a pleasant good evening to everyone listening both at home and abroad. It is always a pleasure to address you, thereby providing relevant information and updates as regards to our present COVID-19 pandemic status. Today is the 46th day without recording any confirmed positive case by PCR testing. This is obviously very good news for all of us and speaks very much to the effectiveness of the public health and social measures that have been put in place, as well as our compliance and adherence to these measures. Having said this, we must not lose focus and become complacent. We are aware of the fact that approximately 1/3 of cases may be asymptomatic, but fully capable of spreading the virus. It has been a trying and testing time for all of us, having to change our normal lifestyle, the way we socialize, particularly wearing of masks and physical distancing. In other words, our new normal, which has led to quarantine fatigue. Over the past weeks, it is noticeable that many of us have let down our guard, and this is surely not in our best interests. Some restrictions were relaxed to cater to our mental health and physical activity, and not to imply that we are COVID-free. We must remember that COVID-19 is spread by a respiratory virus, and for this reason, I encourage you to continue wearing your mask and practicing physical distancing. This is the best way of showing your public spirit of concern for our families, friends, loved ones, the clinically vulnerable and elderly, and our country on a whole. While we continue our public health and social measures, the Ministry of Health is not waiting for new cases to show up. We are being proactive and continue our surveillance and case identification activities. We continue to test our frontline workers and all persons fitting the case definition. As you are aware, our community testing has started and is ongoing even as I address you. This will give us an idea as to our level of immunity in our communities, and also a clinical aspect in that we will also be able to identify cases. Anyone found to be positive on community testing will be further tested by PCR. The Ministry of Health expresses its deepest appreciation to all the households who are participating so willingly in our community testing. This we are extremely grateful for and can be seen as your contribution in the fight against COVID-19. The key to containing transmission remains tracking, tracing, testing, and isolation. That is, until a vaccine can be developed, which in the most optimistic circumstance will not be within 1 year. Our technical health team continue to assess the situation regularly and make recommendations regarding the opening of the local economy and relaxing of restrictive measures. We are recommending that from Monday 25th May, curfew hours will be Monday to Friday, 8 p.m. to 5 a.m. Saturdays and Sundays, 6 p.m. to 5 a.m. It is also recommended that as of 25th May, opening hours of business will be Monday to Friday up to 6 p.m., Saturdays up to 3 p.m. It is recommended that buses allow no more than 3 persons per row. Recommendations have also been made for the reopening of churches, restaurants for sitting-in service, and gyms. Discussions with these stakeholders are ongoing and will continue this coming week to develop guidelines and protocols with the hope of opening next weekend. The Ministry of Health has also been having extensive discussions with the Ministry of Education as relates to our students, details of which will be made available in subsequent briefings. All of this being done with extreme caution as to avoid sacrificing our present health status and gains that we have made so far. As regards to opening of borders, the regional discussion is ongoing, but locally, we have been developing our national plan as well. We have been receiving Dominican nationals, most of whom are students and crew members from the cruise line industry. All of these returning nationals are presently at our government quarantine facility in Portsmouth, and all remain asymptomatic. On completion of quarantine, these persons will be further discharged to home quarantine and monitored by the district health teams. We urge all of those in quarantine to adhere to the quarantine guidelines and see it as their contribution to the fight against COVID-19 in Dominica. We must be fully aware that returning nationals and opening of borders will put us at risk of importing cases. The Ministry of Health will take all necessary action in limiting that risk as much as possible. Before I close, let me take this opportunity to again thank the friendly governments of the People's Republic of China, the Bolivarian Republic of Venezuela, and the Republic of Cuba. I would also want to express our gratitude to the World Health Organization, to PAHO, and to CAFA as well, and also to all local businesses that have assisted in one way or the other. And as usual, our deepest gratitude to all the frontline workers and to you, the listening public. May God bless us all. May God bless Dominica.